The word diabetes alone refers to diseases involving excessive production of urine. But usually when we say diabetes, we're really talking about diabetes mellitus. There's another type called diabetes insipidus, which is a kidney disease, which is rare. But so generally we're talking about diabetes mellitus, which literally means sweet honey diabetes. And it refers to excessive sugar in the blood. And in that case, that's what causes the excessive urine production. Diabetes mellitus is not one single disease, it's a group of diseases. And it's a group of different diseases that all lead to high levels of sugar in the blood. And the reason it's a disease is because it can lead to many complications in many different systems. And so when you have too much sugar in the blood, then the sugar can bind to proteins and cause problems with the nervous system and with the kidneys and with the eyes. And then there's also a relationship with it where the whole metabolism of the body gets disrupted, and it's related to how the body uses fats and sugars and can lead to heart disease because of clogged arteries. There are actually many, many different types of diabetes. They're kind of divided into categories. So type 1 diabetes, which also has been in the past referred to as juvenile diabetes or insulin-dependent diabetes mellitus, or sometimes IDDM for the initials of that, is a disease that's generally occurs in childhood but can occur in young adulthood and even later adulthood, where the immune system, usually caused by the immune system destroying the cells in the pancreas. There's cells in the pancreas called the beta cells that make insulin. And insulin is the hormone that you need in order for your tissues in your body to take up and use glucose. And so in most cases of type 1 diabetes, people lose the ability to produce insulin because of their immune system. So there's the other quote unquote type of diabetes people know about is type 2 diabetes. That's kind of the most common group of diabetes. That's kind of diabetes where there's all kinds of problems that can lead to it, but it's some kind of problem in either the production of insulin or the use of insulin, but it's generally, at least doesn't start out as like an absolute loss of insulin. And that can be because of problems with the proteins in the body that are involved in producing or using glucose. Obesity and a sedentary lifestyle and a poor diet and aging are risk factors for type 2 diabetes. There are also genetic factors that are important, and you really need to have some kind of combination of both to have it. Now, I mentioned genes. There's a third category of diabetes where it's kind of a group of types of diabetes where they have a very specific cause. And often that cause is genetic. And so in less common types of diabetes, about 1 or 2% of diabetes, there's a single gene that is disrupted, and there's a mutation, a misspelling in the gene that can be inherited, and it disrupts it enough that single mutation is enough to cause diabetes. The fourth category that we talk about is gestational diabetes, or gestational diabetes mellitus. And that is when high blood sugar is discovered during pregnancy. And sometimes that could be kind of an early recognition of a more permanent type of diabetes, but sometimes it is really truly gestational diabetes, because pregnancy is a time of that increases the possibility of something called insulin resistance. And so insulin resistance is sort of a challenge in the body has challenges in actually using the insulin. So type 1 diabetes is in most cases caused by the immune system. So the immune system is something good that we have to defend ourselves against foreign particles, against viruses and toxins. But what happens in type 1 diabetes most of the time is that the immune system, for some reason, recognizes the beta cells somehow as being foreign, and so it tries to fight the beta cells, and often, and succeeds in killing them off. Genes are a big risk factor for type 1, and so the immune system is controlled by genes, and so there are certain forms of genes involved in the immune system that make people very susceptible to type 1 diabetes, but they don't always cause it. In type 2 diabetes, type 2 is very heterogeneous. There's a lot of different factors at work. There's been over 100 genes that have been implicated to have, each having kind of variations, each having kind of small effects on whether you get diabetes. But then that it's also heavily dependent on the context. So people who might have a certain level of genetic susceptibility, but they're very active, might not get diabetes, or might get diabetes much later than they would have if they weren't so active. So that's the interaction that we see in type 2 diabetes, again, very complex. The third category I mentioned can have a variety of causes. So sometimes it can be due to something that's very simple to understand, which is just like if you have an injury to your pancreas, then it's easy to see why how the pancreas maybe would stop producing insulin or have difficulty producing insulin. There are also certain diseases that lead to the risk factors. So for example, there's a rare condition called Prader-Willi syndrome where children and then adults have difficulty they can't control their appetite at all, so they become very obese. And so because they become obese, they become at risk for type 2 diabetes. There's diabetes that's caused by things like transplants or steroid use of certain medications or exposure to chemicals. And then we get back to the genetics part, where there's certain types of diabetes called monogenic diabetes, where a specific mutation in a single gene is enough to cause diabetes. And it's the way it manifests is you end up seeing diabetes occurring sometimes at a young age, and then gestational diabetes, as I said, the pregnancy and the hormonal changes and the physical changes of the body put the body more at risk for insulin resistance. And it's also, the other thing that happens during pregnancy is that often diabetes is asymptomatic. And so women are now routinely screened during pregnancy for blood sugar. And so sometimes what's happening in pregnancy is that it's being recognized for the first time because it's being routinely screened. For diabetes in general, the symptoms that people sometimes will have, but not always, will be, as I kind of alluded to earlier, excessive urination and excessive thirst. So that often will prompt concerns about diabetes. In young children, especially when they get type 1 diabetes, the process of destroying the beta cells can be very fast. And so that can actually have a very severe manifestation where they can be completely unable to process sugar, and then they start having to get all their energy from fats, and they start producing ketones, and they can go into a coma and end up having to be in the emergency room. So a lot of times an ER diagnosis for type 1, but for type 2 and sometimes with these other types, it's very often asymptomatic, and it's estimated that type 2 diabetes accounts for maybe 90% of diabetes, and it's estimated that about half the people who have type 2 diabetes don't know it because they don't have symptoms. People have to take insulin injections. Sometimes that's in terms of multiple injections. Some people have an insulin pump that can deliver the insulin on a programmed schedule. But then there are other treatments for diabetes that include pills. So there are many different kinds of diabetes pills. Some of the diabetes pills can help the pancreas to produce insulin better, and then some of the diabetes pills can help the tissues to use insulin better. And then another treatment for diabetes, especially type 2 diabetes, is diet and exercise. So when people have developed type 2 diabetes, or they seem like they're on the verge of developing type 2 diabetes and are given a diagnosis of something we call prediabetes, then often, if they increase their amount of physical activity and reduce their calories and fat grams and carbohydrates, then they can often either prevent or delay the onset, or if they've already been diagnosed, they can get their blood sugar back to a more normal level and may not need to take medication. There are many different types of diabetes, and knowing the type of diabetes one has, if possible, is really, really useful and important.